of practice defines the limits.
Press overhead, try not to let your back arch.
I know when I first started TRX.
So maybe we cue out of that.
Previously with our overhead squat effect.
So we're looking to see at the feet, knees.
Hello, everyone, and welcome to our latest installment in our Return to Performance series. In this episode, we're going to be covering golf and rotational sport programming. This is actually going to be a two-part series since if you guys have tuned in to any of our other episodes, you know Ken and I have a tendency to cut things short. We tend to be a little long in the tooth, a little long-winded, and so we thought we would kind of break this up into two parts. And today we'll cover more conceptual topics related to programming, return to performance programming for rotational athletes, with an emphasis on golfers. And we'll get into some return to performance assessment considerations. We'll talk about some communication elements in terms of how do you communicate the value of what you do as a trainer, as a strength and conditioning coach to the athlete, number one, and also to their skills coach. So based on the things that you find from your assessment, based on what you want to do from a programming perspective, how do you tie that back into really what's important to the coach, what's important to the athlete, and what they're trying to accomplish along the way. And then we'll get into some programming elements at a real high level, just to kind of preview what we'll cover in our next episode. We'll actually get into some program design specifically and cover some of the various components that you'd want to include when working with a golf and other rotational sport athletes. So, with that, I'm super excited to get into this topic, in particular because my good colleague Ken Miller here, who's on with me, has some extensive experience working with golfers in particular, but also other rotational sport athletes. Done quite a bit of work in baseball as well, and based on our previous episodes, you're well aware that Ken's got experience working with a number of different athletes and sports, and this is no exception. So I'm excited. I'm looking forward to learning a lot here, and I know we're both very happy to be back on. It's been 2 or 3 weeks now, probably 3 weeks since our last episode, and we're excited to be coming back and doing this for everybody. So I hope you enjoy, and with that, let's get into it. Ken, do you have anything you want to add?
No, this is one topic out of, what is this, our 8th episode right now. So as we get into this, man, already 8. I know we say that every episode. It's like, man, it's already been 5. It's already been 6. But I think at this point in time, we're just building upon the same idea of the fact that, when it comes to athletes, whatever level that they're coming from, they don't have to be coming from injury to be at a point where they can implement the information that we're talking about, or a healthy person, relatively healthy person. If some of the components that we're going to discuss today does fit, what they need physically, then by all means, this is something that can be implemented into the program. Just because, Tony, I'm not sure about you, but from the other previous webinars, I've gotten some emails well after the fact, because as people watch, say, episode 1 or episode 2, they're just getting familiar with the content that we put out there. Definitely have gotten some feedback and questions on how they can implement it with just their general population. So if someone isn't incorporating like an assessment process that we might mention, and they've added it on, well, that opens a whole set of options on what can be added into their current clients' programming. So I think that's the only thing I want to add in there is that, if there's something that we bring about, and that's what these webinars are for, is to introduce concepts and ideas as, you and I, Tony, have experienced them in our path of servicing athletes, whether they're professional or junior high school kid, just wanting to stay safe and healthy. If there are points that we bring up that you are now practically applying or interested in doing, but want more information, definitely reach out to us. But I think, when it comes to return to performance, it's just, it doesn't even have to be a return from previous experience to whatever activity we're discussing. In this case, it's golf and rotational sports, but it could just be an introduction also into an activity. Again, I think especially in this time of, shelter in place, actually, we're still locked down here in California. So some people are taking this opportunity to try new things and to do new things with their workouts or sports and recreational or interests. So, and if fitness and recreational activities are one of them, and in this case, golf, definitely take this information and use it into your, integrate it into your current practices. So,
Yeah.
All right.
Great points. Yeah. And obviously with how things have been, golf is one of the perfect sports or activities to get into and do when you're trying to maintain some level of physical distance between individuals. So I've noticed, quite a bit of interest in some of the people that I work with and have trained previously, getting back into golf where they maybe have taken a hiatus because, it's one of the few options that offers that, level of physical distance. So
yeah,
cool.
Yeah,
I like that tumbler you had. What was that?
Yeah, I like it. Thanks, Cypress.
Very nice.
It keeps it cold, keeps it hot.
right.
Whatever's in there stays in there.
Beautiful. All right. Well, let's get to it. So I think, as we've done in previous episodes, if you have questions or as we go through some of the content related to golf or rotational sports, specifically around common injuries or things that you may encounter some of your clients coming back from, you can refer to our previous episodes in the series related to ankles, knees, low back, and shoulders, where we get into some specific considerations around coming back from injuries in those regions of the body. And we're certainly going to address and touch on some of those here as they relate to golf and rotational sports specifically. So, with golf specific injuries, typically you're going to find, individuals coming to you with hip injuries or hip pain, low back, shoulders, elbows, and wrist. Those are some of the more common areas. But generally, when we think of golf or rotational sports, low back is probably one of the number one complaints and concerns when working with individuals who perform this type of activity.
Right.
Then you might find elbow, golfer's elbow or tennis elbow, but more recently, as I mentioned, Ken, and I'd love to get your take on this too, as I've worked with quite a few individuals who are either getting back into golf or golf is their primary form of sporting activity. I've encountered a few injuries beyond, or few injuries or aches and pains and kind of chronic soreness beyond just the low back. And so, every one of these right now, I'm kind of dealing with clients that I'm seeing and who participate in golf. So, with the hip, I've got a guy who gets some anterior hip pain on his lead leg. Low back is very common. Seems to be left low back for my right-handed hitters. Shoulder, bursitis, impingement, some of the things that are affecting them on their backswing and follow through, depending on which client you're working with. Elbow, as we already mentioned, and then wrist. Actually have a client who's been suffering from impaction at the wrist, and that's something else you might encounter in some of the individuals that you work with, and that can either happen on the lead, kind of the lead hand, the lead wrist. However, with this particular client, it's on her trailing wrist,
right?
Which is kind of interesting on the radial side versus the ulnar side. So a lot of different things going on, and I think Ken, I know when we get into it, you're going to break down some of the elements of the golf swing in particular. And when you kind of look at the dynamics and the sequencing and the forces involved and that are required to swing a golf club and make good impact with the ball, essentially every joint in the body is involved. And so when you get into when we get into our assessments and you kind of look at how each region of the body can impact the other regions, it's no wonder why you might see some injuries that span the entire body with golfers. One thing we didn't mention was the knee, but obviously depending on hip rotation and ankle mobility, the knee could also be thrown in there and get cranky with your golfers too. So anyway, one of my usual vomit at the mouth pieces here, but anything you want to add as it relates to some of the specific injuries that you have encountered or typically see with your rotational athletes and more specifically your golfers?
The thing is, I always revert back to my one of the things that I've learned from our mutual friend Anthony Carey. The statement that I learned from him, I think I've brought this up in previous conversations with you, Tony. Is basically what the hips lack hurts the back. Right. So if your hips lack range of motion or flexibility, if it lacks stability, if it lacks strength, the back is sure to take a hit because it's going to try to make up for what the hip is denying the rest of the body. So just, I know we're going to talk about, assessments in a little bit, but to pick on one, hip internal, hip external rotation, where overall you want, if you're getting a 90-degree arc between, let's say, if we're going to square it up evenly, 45 degrees of hip internal rotation and 45 degrees of external rotation, you have 90 degrees there. Wherever that arc is, it's going to be, based on, one, individual hip structure and what range of motion is allowed and to what extent. But if let's say you're in the seated posture like we're in now, and you're doing this, 8, 9, 10 hours a day between your commute, time behind the computer for work, and then sitting down, watching TV, watching movies, or even, you're a gamer or whatever. A lot of that stability and range of motion goes away. So now if I'm trying to do this nice ballistic motion of, rotate right to left with a right-handed golfer, now I'm asking for all this range of motion out of the hips. And if I don't get it out of the hips, it's going to have to come from somewhere. So in some cases, the compensation can show its way down the chain into the knee and then downward towards the ankle and the foot, or it can work its way up. And so its nearest neighbor above it, which is the low back, we'll definitely have to try to make up that range of motion. But if you're looking at how much range of motion we're getting in between the vertebrae, we're only talking a couple degrees. So between, T12, L1, and L5 and S1, we're not getting, 2 degrees between each one of those discs. That doesn't amount to a whole lot, but we're asking a ton from that region. So if someone's got low back pain, again, the statistic that we like to, go back to is that 80 to 85% of the population in the US at least is going to has experienced or is currently experiencing some kind of low back issue, and a lot can be attributed to the low back. Now, the next thing I like to talk to athletes or golfers in this case about, as far as the second part of that conversation, okay, if what the hips lack hurts the back, now we have to talk about regional interdependence. So now we have to go beyond hip low back relationship. Now we can look at, those issues with, golfer's elbow or your client with wrist issues. We can't just say, in a lot of how therapy works is that if someone's got an elbow issue, what are they going to treat?
Mm-hmm.
They're going to treat the elbow, but if it's because my hip doesn't rotate and I'm trying to get all that speed and range of motion out of my thoracic spine, out of my shoulders, elbows, and now wrist, as we go through that whipping motion of the golf swing, people will just try to manufacture speed and power. And if it doesn't come from one area, they're going to try and harvest that from someplace else. And if we're looking at, big muscles being in the hips and the trunk, and then the smaller muscles as we work out to the extremities, big muscles will win with power every time. But if they're not in the game, then you're asking a smaller area to do a bigger job. So to talk about those injuries, I like to just pick on the hips first, and then have my decision tree work away from there. So if you show me that, if you're telling me you have an elbow issue, and we're doing the overhead squat, single leg squat for starters on the assessment process. Well, if you're showing me that you have really good hip mobility, you have a decent single leg squat, and you're maintaining, level hips, and the knees are staying in place for the most part, then I can look at other areas for the reason for compensation that would cause an irritation in that area, in that region. So when it comes to injuries, that's where I tend to look first. But if we all understand that compensations can start from the center and then work their way out, they can start from the top and then work their way down, or they start at the bottom and then work their way up. If you keep all those options open as we start to discuss the assessment process, we are not shutting out any data points that can affect how we put programs together. So again, looking at injury sites, what we'll typically hear about on what our clients and athletes are complaining about, and then you use the assessment process to kind of stitch it all together. But that's an ongoing process as you go from the first session to the second and to the third session, especially when you're dealing with skill and the golf game specifically being about skill.
Yep, no doubt. Yeah, that's all fantastic points. And I think, we keep speaking in terms of injury, but this can apply to general soreness as well. Not necessarily have to be an acute injury situation or somebody who's gone through rehab. When you think about the forces involved, the repetition involved,
right.
Sport in general, tends to make athletes sore just due to the fact that they're performing the same patterns over and over again. And so these are some common areas of soreness as well. It doesn't necessarily have to be an actual injury that somebody's coming back from. But if left unchecked, could certainly manifest and progress into something much more significant, and that could require some intervention by appropriate medical professionals. So
And one thing I want to piggyback onto that too is, and when we talk about talking to the athlete as well as the coaches, and if you're talking about soreness on top of pain, discomfort, or whatever the situation may be, I'll also ask, do you feel that in practice, like when you're on the driving range and you're hitting a large bucket of balls, or do you feel it when you're playing? Do you feel it after you play? So also putting some context on what might elicit issues. And some people might have no issues at all, and everything that we bring out is only because of what the assessments tell you. So
Yeah.
just to add that little bit onto that.
Love those little nuggets.
Yeah.
The Millerisms. So assessments. Again, your assessments are going to provide you with that baseline. It's going to help you identify, strengths, areas of opportunity, as well as, give you the data that you need to start creating that roadmap to get your clients performing to the level that they desire and that they need to be. And so, as it relates to rotational sports and again, in this case, golf more specifically, Ken, you already alluded to, kind of our foundational assessments, which would be the overhead squat and single leg squat. And overhead squat assessment, single leg squat assessment are super relevant here with golfers because they have to interact with the ground, and how they interact with the ground is directly going to influence, how they swing the club and where and how far the ball ends up going. And so by using a total body pattern like the overhead squat that allows you to address and observe the lower extremity, the lumbo-pelvic hip complex or the core, as well as the upper extremity, it's just a fantastic gives you an overall snapshot of your client's functional capacity and movement quality. And then the single leg squat is also extremely relevant because of the weight shift or the transition from one leg to the other during the golf swing. So I don't want to use the term weight shift because that's not necessarily ideal. But we need to have good single leg stability. We need to have good hip and core stability while performing by accepting more weight through a single leg. And so single leg squat, overhead squat, two very relevant and valuable assessments. And so, you just want to first kind of, see what you can glean from those two. And, then you can start working your way down your assessment tree. And, if you need if you need additional information on those assessments, I know we covered those in detail in previous episodes. And then obviously all the NASM courses touch on those two assessments as well. But those are fantastic to give you that overall impression of, total body flexibility, neuromuscular control, movement and movement quality. And then with the single leg squat, how are they able to control their lower body, pelvis and trunk while standing on a single leg. And, that'll give you insight into what you might see as they transition through different phases of their swing. And then, from there, some additional assessments that you may want to look at. We've got our star excursion balance test, and you can perform that both with the lower extremity and the upper extremity. Lower extremity with this particular test, your client is going to be balancing on a single leg, and then they're going to be reaching in different directions, forward, lateral, posterior medial. And you want to see in what planes or directions they're maybe more deficient, as well as comparing symmetry between the right and left sides. And then in the upper body, you can do the same thing where you're reaching with the upper extremity in different directions. And so that can give some insight into core and trunk stability, as well as shoulder girdle stability, which all of which are extremely important to the golfer and rotational sport athlete. And the nice thing about the star excursion tests and for both the lower and upper body is that it's a way to quantify that control on a single leg and in different directions. So there's a measurement involved, and then you can also, again, kind of identify any imbalances in symmetry between the two sides of the body. So those are some great ones to include. And then, range of motion and mobility assessments, those are also going to be critical. Again, as you start to kind of narrow your focus and you try to kind of isolate the areas that are most in need of attention from a programming standpoint. Again, the golf swing is a, total body pattern. You've got to have, specific sequencing from the toes all the way through the fingers. And if there's a segmental limitation somewhere along the way, from a range of motion or mobility standpoint, then that's going to directly affect how the entire chain works through that swing pattern. Ken, do you have anything you want to add on that before we get into some of the specific mobility assessments that we might recommend?
Yeah, I mean, I think if you keep that in mind, that it is a chain of events. So when you talk about the kinematic sequence as it was introduced to me through Titleist Performance Institute, that's just, going from hips through the trunk, through the shoulders, elbows, and the wrist. So it's not just an isolated, we can put these numbers together where we look at ankle dorsiflexion, hip internal, external rotation, knee extension, and hip extension, and of course, looking at shoulder internal, external rotation and flexion. But, it's also how things are put together. So we can add those, like what we called it in the past, those data points. We can have those data points and we can say, your hip extension is, +5 versus the necessary, or, the textbook -5. And that's just one blip on the radar. But, someone can have a 350-yard drive with that, with that number, or with that assessment number. So, looking at those areas, if there's something that does pop out at you as far as, okay, well, his right ankle has so much range of motion and the left ankle has, 10, 15 degrees more, we do want to look at, okay, well, what are the possible ramifications of, if we don't address it, even though he's swinging great, he's got great performance, but he's not moving efficiently as a human being, as we would call it. But just understand that, whatever we look at as far as the numbers on, if we're using the goniometer to stitch together and create this number-based image of your client, there's also how they use it as well. But again, as we talk about our swing characteristics, what we are trying to do is have you, however you swing, have you do it more efficiently and with decreased risk for injury potential.
Yeah, no doubt. And I know you and we use a goniometer quite a bit when we speak to some of these assessments, range of motion or mobility assessments. There are options that you can perform without the use of a goniometer, and we highlight those in our updated CES credential. And essentially those are going to be more of a pass-fail type criteria, but still arm you with some tremendous data and insight into your client's movement potential, and where along the way there may be some roadblocks and barriers that could cause them to move and do things differently with their swing as a compensation mechanism. So ankle dorsiflexion, where the rubber meets the road, is extremely is extremely important for the golfer, and sometimes this is overlooked because we do talk a lot about hip rotation, trunk rotation, hip extension, shoulder mobility, but ankle dorsiflexion, typically, and with respect to ankle dorsiflexion, we're only looking at ankle mobility in the sagittal plane, but as it relates to the golf swing, the ankle does move in 3 planes, and we have to, if the ankle doesn't move well in the sagittal plane, then that's going to create additional compensations in the frontal and transverse plane that could influence the setup and the stance of your golfer, and how they set up can directly impact how they go through that kinematic sequence, how much rotation they have available to them, both on backswing and downswing and follow through. And so even though we don't think of the ankles as being an integral piece of this, they actually are. And then when you think about competitive golfers versus maybe your more recreational golfers who have the ability to use a cart to get around, when you look at competitive golfers who have to walk, if they lack ankle mobility, then as they're walking from hole to hole, round to round, if they lack sagittal plane dorsiflexion and they have to compensate when they walk by turning their feet out, that will lend itself to certain muscle imbalances in the lower leg, at the knee, and then ultimately up into the hip because of the muscles that are involved there. So when you think about we've talked about this in some of our region specific episodes, but if the lower leg and foot turns out, and let's say there's an increase in pronation, that's going to affect your distal tib fib joint. That's going to affect the peroneal musculature. Then that'll have an impact on the proximal tib fib joint, which then affects the biceps femoris, short head, long head. That's going to go up into your hip and pelvis, which would affect hip internal rotation. So, you could be doing everything you want for hip internal rotation, and you might see short-term gains based on that. But if the root cause is a lack of ankle dorsiflexion, and you've got these guys, walking 36 holes with poor ankle mobility, then that's going to have a cascade of effects all the way up the chain. And so ankle dorsey, something really important to consider that you may not think about being important, but it really is. And from there, we can get into knee extension from a 90-90 position, or you could do a straight leg raise just to see what influence the hamstrings might be having on everything. So if you have that client whose feet turn out, knees go in, that short head of the biceps fem might be overactive and short, and you might want to assess that with a knee extension test or with a straight leg raise. Either way, those things can either lead into alterations in hip extension range of motion, or as mentioned just a moment ago here, hip internal rotation. So again, things that you may not think about, but because that golfer, they have to interact with the ground to create that power that will ultimately translate to the ball. You have to assess their ability. You have to assess, how those joints that are interacting with the ground are actually functioning and moving. So,
right. No, a lot of good stuff there. And, just to talk again, just pick on the ankle a little bit, which it's very easy to pick on the foot and ankle because of how much they influence everything else that's above it. But, let's just take, if depending on where the ball is, if the ball's elevated relative to where you're standing, so if it's lying on the side of the hill, right, I'm going to need more dorsiflexion that way, right? So also from the standpoint that, when you talk about footwear, it's they're wearing hard sole shoes with cleats, right? So if that's what they're walking in, the foot and ankle don't get a whole lot of opportunity to do what they're supposed to do. So what the foot's supposed to pronate and supinate, and we're not giving that full range of opportunity to move. If that's what you're doing, if you're putting 2 rounds back to back, that's a lot of mileage that you're putting together. So, but also a lot of immobilities can start to build up depending on how frequently you do something like that. So, footwear winds up being something that winds up limiting or affecting how you move from a human movement system standpoint, but also having that ankle dorsiflexion is going to be important because you want to have options. When you're playing, you can't just say, well, let me stand on a platform where I don't need a dorsiflex as much. So it's easy to just pigeonhole golf as it's just the swing. And you bring up a great point, is that I got to walk.
Yeah.
Right. And depending on, how good of a golfer I am, I might have to go deep into the weeds. So if you're playing with me, you're going to say, hey, can you check over there? Did you see my ball over there?
Yeah.
So if you're going to have to go down a couple of hills and walk, around walk around the water a little bit, you're going to have to, have some options available from a movement standpoint. So a lot of good stuff there about what happens in the chain of events if and when the ankles don't move well.
Yeah. No, bring up great points too. Once they're actually out on the course, walking aside, just based on terrain, based on, where where you have to hit from. If you're in a bunker, you're on the side of a hill, all of those things. Your ankle mobility will certainly play into, how you're able to perform in those situations too.
Right.
Moving on up, getting into the hips and lumbopelvic hip complex. We've talked about hip internal, hip external rotation. Those are going to be critical. What the hips lack, what is it?
What the hips lack hurts the back.
Hurts the back. That's right.
Yeah.
So, those are going to be two critical things to evaluate and address with your golfers and rotational athletes on a regular basis. And I know in a previous episode, we talked about how lead leg hip internal rotation can have an impact on, let's say in a throwing athlete, on their throwing arm. In a golfer, it could have an impact on their trailing arm. And so that's going to be super important. And again, if the hips are lacking rotation, then, you may see increased movement in the frontal and transverse plane at the knee and at the foot and ankle as well. And so it can have, as you mentioned earlier, it can go from the top down. And either way, you're going to end up restricted in both scenarios. So, going to be super important. The other thing is hip extension, in particular on that trailing hip. As if you look at the swing, and I know you're going to break down some of the different elements of the swing here shortly, but from the downswing to follow through, you've got to have the ability to extend that trailing hip and internally rotate over the lead hip. And so that's going to be one that we want to look at. And then super critical, trunk rotation, as well as trunk lateral flexion. So when we look at, mobility of the thoracic spine primarily with both of those are going to be critical as well. If that thoracic spine, if you don't get that, 45 degrees, roughly 45 degrees of thoracic spine rotation, then the low back may have to take on the brunt of that.
Right.
And your body may try to eke out more movement in those segments that really aren't designed for that. And from a lateral flexion perspective, that's also going to be important because as you rotate the thoracic spine, as you rotate the spine, there is an element of lateral flexion involved. And so something that I've been seeing lately, and Ken, maybe you can talk about some of the individuals you work with, but and some of my right-handed golfers in particular, they've been more limited in right lateral flexion, which means that their left side, they're laterally flexed more their left side than they are on their right side. And then kind of connecting the dots between that and their movement assessment, their right leg single leg squat is much worse than their left leg single leg squat. And so when you look at that lateral subsystem and how the body kind of finds strategies for stability and control, it's kind of interesting to connect the dots as far as that QL is concerned, and compensating for maybe potential underactivity in the core stabilizers as well as the glutes. And so, if you think about that as you, let's say, follow through impact and follow through, if I'm rotating left, I should actually be laterally flexing to my right. And so if my left side, if I'm stuck in lateral flexion on my left side and I don't have good mobility going to my right, well, that's going to directly affect my ability to follow through in my right-handed swing pattern, right? So those are going to be two that kind of work in concert with each other, and that you want to assess with your rotational athletes. So that's a big one. And then kind of moving on up into the shoulders, we've got our shoulder flexion. Lat extensibility is going to be huge, both on the backswing and follow through. And then your shoulder internal and external rotation are also going to be important. Again, with respect to both sides. And it's interesting, that golfer that I'm working with right now with the wrist issues, her external rotation on that same side is relatively limited. And so if you think about the backswing, there's an element of external rotation on that arm. And if there's an inability to get that full external rotation, well then, the wrist may get impacted a little bit from that. And so again, it's kind of interesting as you look to connect the dots and figure out, what's going on here. You can compare the range of motion requirements in the swing to what your mobility assessments are showing you. It makes it a lot easier, one, to communicate to the athlete, which you'll get into, but also from a programming standpoint, really gives you some great insight and guidance into what you should focus on.
Right. Yeah. And those and when we talk about the swing characteristics, we can get into that a little bit, but just so we're all clear, we talk about the golf swing, we'll talk it more from a fitness and conditioning standpoint, not as a golf coach. And because I'm the last person.
You don't want me coaching you. Yeah. Well, from
hold that into the club, and then you just gotta go that way.
From a conditioning standpoint, I might be a great coach because you'll be walking a lot to find your ball if I'm trying to help you with your swing.
You'll definitely get your steps up. You'll get your 10,000 steps definitely with me. But you talked about you had a lot of great nuggets in there, Tony. So one of which was the fact that when we're talking about the lateral flexion and you might get a little stuck, more biased one way towards the other, and a lot of times that is something strong to consider because that's what the athlete's going to talk about, right? That's what they're stuck on. Of course, they're reading like Golf Digest or Golf Magazine, and they're saying, okay, well, this is, I'm slicing, and I think this is what's happening. So you have to be able to kind of speak to that a little bit. But from a movement standpoint, we also understand that all joints move in all planes of motion. So chances are, if I'm stuck left and I'm having trouble going right, chances are I'm also going to be limited in flexion, extension, and rotation as well. So one of the tactics I might use there, and we'll discuss this when we talk about program design, is look at where we can find range of motion, give the joints, some confidence in moving one plane of motion, and you might be able to free up movement in another plane of motion, right? Because it's like, if I keep going this way, it's like banging against the wall. I'm not going to get anywhere. But if I do explore where I can have success, or if I can find success, if I get stronger or more reliable in one plane of motion, the brain might give me, of course, with implementing other strategies to work on rotation and flexion, because in golf it's all combined, right? So you have to dive into that. But as far as the shoulders go, one area that doesn't get a whole lot of air time is the scapular-thoracic joint. It's the relationship of the shoulder blade and the rib cage, because we tend to get stuck on talking about what's happening right in here versus what's happening with my shoulder blade as it lies on my rib cage, because it's got to do all of this, right? Elevate, depress, retract, protract, and upward and downward rotate, and do it all at the same time. So one thing that I look at is okay, well, how well is the shoulder blade moving? And that's not something that in the list of areas that we can take a goniometer to, it really kind of flies under the radar from that, unless there's something you're doing, Tony, that I'm not, but that's, again, if we're here and I notice that somebody's doing more of this, I'm going to suspect not only is there issues, with the usual suspects, right? Pec major, lats, levators, things like that. But I also want to look at what's happening at the shoulder blade that can contribute or take away from how the thoracic spine is moving, because that's going to show itself in the neck and in the low back as well. So, but that's where, if I'm looking at the shoulders and if there's enough stuff popping out at me, then I'll tend to look more at those scapular muscles, as it will come up anyway in our program design. But that's also a part of the conversation if I'm talking to, the athlete or the coach.
Or the parent.
Yeah, or the parent.
That's a great segue into kind of the final piece to the assessment puzzle, which is the neck. And, again, that's an area that you want to look at and assess for mobility, both in rotation and lateral flexion. Because, the athlete is focused on the ball, their thoracic spine, shoulder girdle, and everything has to rotate beneath the neck. And so neck range of motion, neck mobility is going to be critical. And to your point, all those muscles that control the scapular motions, many of them attached to the cervical spine or the head and or skull rather. And that's going to directly affect your neck mobility. And and obviously that can come with a whole host of problems because of that. So anything that you tend to focus on there?
With the cervical spine, it's I'll do the typical, look right, look left, lateral flex right, lateral flex left, and I'm looking for differences between both. So if someone can do this on one side, but then they're like on the other side, and again, thinking about always going back to the golf swing, just notice that if I have range of motion here, but I don't have range of motion there, one's going to affect the backswing and the other is going to affect the follow through. So if they have problems staying down and keeping the head down on the ball, then I have to look at, where's that breakdown happening in the chain of events? Because if they can't keep their head down and they have to look up, well, they might have to either shorten their swing, or like in that example that you're given, maybe they might have to, rotate their trunk, or maybe make it up with more arm motion to keep the arm and club with a better relationship to the ball as the brain is perceiving it. So if it's, that's where I look, because if movement one way and not having movement the other way, it's going to affect either the backswing, the impact zone, or the follow through. So that's where the neck comes into play, because again, that's example of a compensation that can start from the top and then work its way down.
Yeah. Awesome. Great stuff. Yeah. Well, speaking of the swing, I know there were a few key points you wanted to address as it related to, swing characteristics. And this kind of ties into probably the most important piece, which is communication with the coach, with the athlete, possibly the parent. Their outcomes are purely, performance driven and skills driven. And so how do you translate and communicate what you find in your assessment to the coach, the athlete, and other stakeholders, so that it's relevant to them and so that they understand how this could influence what they're trying to accomplish on the course, or from a skills standpoint with their swing development and swing characteristics?
Well, communication is the ultimate, especially when you're dealing with an athlete or a sport. Let's say, if we take a look at the sport of golf, golf is one of those sports where, as you and I were talking about earlier, you have your golf coach, but then you can also have a short game coach, and then you can have a driving coach. You can have a putting coach. So you have, all these people in your ear, and that's not even talking about whatever sports medicine, medical team or staff that you might have as parents might stitch it together for their kids. Like, they have a physical therapist that they go to. They have a doctor, general practitioner that they go to. They might have a chiropractor that they go to. But overall, I want to have as many, I want to have as many opportunities as I can find to communicate with these professionals. So if I'm talking to the physical therapist, we can talk about what we just talked about. With, they're lacking ankle dorsiflexion. This is what we find in our movement assessment, or they're having shoulder issues. But, part of that can be drawn from the fact that their left ankle isn't moving well, from a movement assessment. But when we want to talk coach, as Mike Boyle might say, you have to speak coach, right? The golf is one of those things where, there's a lot that goes into it, and I'll give credit where credit is due as far as my background is concerned. Having gone through Titleist Performance Institute as the first golf-specific certification that I went through to learn about the 12 swing characteristics. One of the things that they really do a great job of is having medical performance and skills work together. So if we all understand what the overall objective is, so when we talk about the swing characteristics, basically it's just a style or a way of, how somebody might address the ball during their golf swing. So we can talk about, just to name off a few here, S posture, C spine, early extension, over the top, late buckles, slide. And if I understand what those characteristics are, then that gives me a better opportunity to talk to the coach. Because if the coach is saying, well, he has an S posture, well, what that translates to me is that this person has an excessive low back arch. And then from a program design standpoint, I can look at, okay, what muscles are doing too much and what muscles aren't doing enough to help address this excessive low back arch, because that is going to affect how this person feels if they do it. If they're like me and they're scoring over 100, that's 100 swings, right? And that's just what you score, right? That's 100 swings with a compensation. So from an exercise standpoint, that's 100 repetitions that I'm reinforcing an excessive low back arch, right? So there's what that means.
With quite a bit of force and stress.
Exactly. A lot of force, a lot of stress. So what the golf coach talks about with the S posture translates to me as an excessive low back arch, right? And all the chain of events that happen because of that particular swing style. But I also want to say that for every swing characteristic out there, there's somebody on tour making $1 million a season with that swing characteristic. So it's not that these swing characteristics are bad. It's just how somebody is performing that movement pattern. And when it comes to golf conditioning, all we're really trying to do is to lessen the stress on the body, because it is a pretty repetitive sport. From if I'm a right-handed golfer, it's going to be right to left, right to left, right to left. The magnitude of the swing and the clubs that I use are basically the only things that change, right? So when you talk golf characteristics, I really encourage people to understand overall, just generally, whatever the sport is, golf or whatever, is just know a little bit about the sport, so that when you are able to, or when you have to talk to the coach or the parent, and they're telling you, okay, well, Maggie saw her golf coach and he says that she's coming over the top, right? Well, that has to mean something to me. And if it doesn't mean something to me at that moment in time, it's my job as the strength coach or fitness professional to look it up and see how that translates into, well, how am I going to blend that into their overall conditioning plan? So when we're talking performance, in golf, we are talking skill. And like it is with any skill, we have to understand the vernacular as it is with that particular sport. So, and then have that mean something to us, so that when I do talk to the coach, I can say, hey, that S posture, one of the things that we're going to work on is opening up her front hip. We're going to work on our ankle dorsiflexion, because she's missing some movement out of her ankles. That's going to affect the movement, as you described so eloquently there, Tony, how that moves up through the lower leg, upper leg, into the hips, and then ultimately into the lumbopelvic hip complex. So, and that gives me rationale, because what you'll get as a fitness professional is a question of, well, why are you doing that exercise? I read that was not a good exercise because of this. Well, if you have grounds and foundation and logic for your recommendation on what somebody should do, something, I learned a while ago, if I can't find 3 reasons why I should be doing something, then I might have to question why I'm doing it. Is it because of habit? Is it because of reputation? Is it because what everybody else is telling me to do? But if I say, well, we need to foam roll the TFL, we need to foam roll the quads, and we need to do a kneeling hip flexor stretch, and we need to do some floor bridges or clamshells, and that's what's going to help address this particular body position or particular movement pattern, then they, there's very little grounds for somebody to say that you're not doing the right thing for that athlete.
Yeah.
So
no doubt. We could probably spend a whole episode just talking about rationalizing.
They spend 2-3 days just talking about the golf swing. So so let's
and rationalizing exercise, right? I mean, I know you in the graduate courses and programs you've taught in as have I. I mean, that's one of the biggest things that we try to hammer home is having a rationale for the exercises that you put into your program. And if you don't, then you got to look introspectively and kind of figure out, okay, what are you doing, and are you operating and acting with the client's best interests and desires and goals in mind. So so that's an excellent point you bring up when it comes to rationalizing exercise and the choices that you put into a program. Makes it hard to dispute or kind of argue that if you have a sound understanding of the individual that's in front of you and what they have to do to perform in their respective sport and develop specific skills. And I totally forgot where I was going with that. But
I like whatever you just said it's good either way.
So anyway, you can't argue that if you're able to come to the table with the ability to rationalize your choices in that fashion, and you'll gain a lot more credibility and respect from those you interact with because of that. Takeaway, if you guys are interested in working with golf athletes and you don't know much about the swing and the skills involved in the sport, that would be a great place to start, is do a little bit of research and dive into that a little bit. And then kind of the underlying premise with this is how do you connect those things to the programs that you put together and the assessments that you do. And, something like this in particular, because the swing is, there's so many nuances to it, and coaches and athletes are always making adjustments and tweaks. You want them to be able to do that and have the option to do that. And that's really what you're giving them is you're providing them with the freedom to be able to make those adjustments because their body, their body's not getting in their way. Right. So that's really what it comes down to from, our value in the process. One of the value propositions that we can provide and offer in that process.
Exactly. So, and overall, health first, performance second. If you get somebody moving well and their joints are healthy, performance is going to follow. Yeah.
Cool. Well, we covered some great stuff. Obviously, we're getting close to an hour here, and that's exactly what we wanted. And that allows us then to spend our next episode actually going into some program specifics. I think we've done a nice job setting the table with this one in terms of, what are some of the things that you want to consider from an assessment standpoint? What are some of the areas of soreness, discomfort, pain, and possibly injury that you could encounter with this type of athlete? And then, when it comes to putting that program design process in motion, how do you translate the assessment results into language that is going to resonate and is relevant to the athlete and the coach and anybody else who's involved in the process.
Exactly.
And so, generally speaking, from a programming standpoint, we'll kind of follow a similar approach in our next episode to what we've done previously, where we'll talk about some self-care strategies. What can you do to empower your athlete and your client to improve themselves and kind of work on these areas of opportunity when they're not with you. And from a scheduling standpoint, what does it look like in terms of days off? What are they doing prior to training and prior to maybe playing a round of golf or practicing? How similar do those programs look? How different do they look? From a performance and strength and conditioning standpoint, what are the different phases of training that you might program for them? And within that, what types of exercise options are you going to look towards? And I know, this is where I'm super excited to hear your thoughts on this, Ken, just because of your programming style and the number of tools and techniques that you incorporate into your program design and program implementation process. And then, from there, how do you progress those things? What value do different modalities offer? So we'll talk about some different things that you may consider or look to consider incorporating into your programs that you might not currently for this type of athlete, whether it's, stick mobility, body weight, elastic resistance. You mentioned Anthony Carey and obviously there's the Cortex, going a little old school.
Yeah.
We can talk about body blade. You've got cables, kettlebells, med balls. I mean, there's a variety of implements that all could offer value. And so how do you plug and play those into your program to get maximum benefit and engagement with your client? And then, a critical piece, and we talk about this every time, is the recovery component. And, with any sport, and as Ken, you mentioned earlier, just the repetitive nature of golf, opens the door for things to get angry. And, you might get some overuse patterns and things develop. And so where in the process can you incorporate recovery strategies and utilize recovery modalities to aid in, mitigating some of those repetitive strain or repetitive pattern situations.
Yeah.
So we'll talk, obviously we're partial to Hyperice. They've got a number of great tools, and we'll get into some of those specifically as well, and how you might be able to incorporate those into your clients' day-to-day routine, because they offer a number of different options, and each tool offers specific benefits and can be leveraged in different ways depending on how your clients are recovering and what else they're doing from a program and activity standpoint. So lots of great stuff to come. Hope you guys join us for the next episode, but I think that does it for us today.
Yes, it does.
Ken, as always, super pleasure to be with you over the last 60 minutes or so, and learn something new as always. And I hope those of you who joined us enjoyed the show, and look forward to seeing y'all next time.
All right.
All right.